You are listening to the Summit FM. Chad Miller here with Dr. Matthew Noble, orthopedic surgeon at Crystal Clinic Orthopedic Center, who sees patients in Fairlawn and Canton, specializing in shoulder and elbow surgery, including arthroscopic surgery, shoulder reconstruction, and fracture care. Dr. Noble, welcome to the Summit. How are you?
I'm doing all right. Thanks for having me today.
Absolutely. Well, you're a Northeast Ohio native. You're from the area. You have earned your medical degree from Ohio University's Heritage College of Osteopathic Medicine in Athens and completed a residency at Western Reserve Hospital in Cuyahoga Falls, just near us here in Akron. And yeah, you're sort of a specialist, an expert in shoulder injuries and conditions of that sort. And just wanted to talk to you about some of those things. As we get older, our body starts to, age along with us. And with that comes shoulder pain. What are some of the main causes of that?
Yeah, so shoulder pain can be caused by a multitude of different issues, that being bursitis, tendonitis, arthritis, even rotator cuff tears. All these causes may be affected by things like your age, activity level, or past injuries. But really now, depending on the cause of that shoulder pain, it may present in a wide range of symptoms, including like increasing pain, restricted range of motion, and weakness. But the main reason people actually come into our office is actually trouble sleeping.
Really? Trouble sleeping. So that's sort of where this can all start.
Yeah, exactly. So like I said, people say during my normal everyday life, I have a little bit of pain. It bothers me. But gosh, when I lay down at night, this thing keeps me up, and then my family doesn't want to be around me in the morning.
Well, that's a fair point. Well, other things that come from shoulder pain include rotator cuff tears. What are some symptoms of that, and does that require surgery at all?
Yeah, that's a great question. So rotator cuff tears are one of the most common causes of shoulder pain. Patients typically have pain in either the front or the side of their shoulder, and it may radiate all the way down to their elbow. Symptoms are worse with overhead activity and often cause, like I said, that difficulty sleeping. Mm-hmm. But most people will actually have full range of motion. They just know that it's limited by either pain or weakness. In regards to treatment, though, we know that rotator cuff tendon is not capable of repairing itself. So rather, the tear will stay about the same size or even enlarge over time. So I generally tell people that if they're under the age of 60, the risk of progression is about 50% in a 2-year period. So the ability to get that thing healing early on comes down to a ton of different factors.
Well, yeah, and that sort of leads to my next question. If you are having shoulder pain, whether it's a rotator cuff tear, arthritis, when should you consider just getting a shoulder replacement?
So for the most part, arthritis, it progresses slowly over time. And age is also a factor in treatment. But in today's day and age, health is much more important. So I always tell patients that a shoulder replacement is a personal decision. Mm-hmm. It's easy for me to tell someone that their x-rays or exam qualify for a shoulder replacement, but only they can tell me if their shoulder is affecting their way of life. So when their life starts getting smaller and they can't do the activities they want to do, that's when we can discuss the next steps and if shoulder replacement's a good option for them.
Well, that's sage advice from any doctor, and it's good to catch up with you. Again, Matthew Noble, a doctor and orthopedic surgeon at Crystal Clinic Orthopedic Center. For appointments or more information, you can call 330-668-4040 or visit crystalclinic.com, where you can now schedule an appointment online 24/7. Again, Dr. Matthew Noble from Crystal Clinic Orthopedic Center. Thanks for taking the time to talk today.
Like I said, thanks for having me.